It took a tour of an ICU at St. Luke's this week for the COVID health crisis to jump to another level for Governor Little. He told us on Tuesday, walking through and seeing intubated patients in critical condition, fighting for their lives, and witnessing the overwhelmed hospital staff trying to keep up. Governor Little told us it was, quote, heartbreaking. Something we've been told for weeks by those same staff members and what we've tried to pass along to you. And how about this time? This COVID surge is putting people who are supposed to be in the prime of their life this close to the end of it.
There are so many of these tragic stories, but I will tell you right now, here in our intensive care unit, we have two young women, one pregnant, one was pregnant. Both of them contracted COVID. Both were unvaccinated, as all these people are who are getting COVID now. They're all unvaccinated. They got COVID. There's now a risk to their own life. There's a risk to the baby's lives, and it's totally unnecessary.
Dr. Emerson said that tragic story is just one coming out of Idaho hospitals as the medical system gets closer and closer to being forced to implement crisis standards of care. It's a major consequence of our medical system being this overwhelmed. It's the simple fact that choices are now being made to determine who gets care and who has to wait. Medical leaders tell us they are pushing off scheduled non-emergency patient treatments so they can just make room and have resources available for the influx of very sick COVID patients that are coming now and are expected to come in the coming weeks. Those appointments and those procedures being pushed back, well, they're not just minor issues. And doctors tell us people are suffering, waiting for care. Here's Joe Paris.
We are at the most extreme circumstance we've ever been in trying to take care of patients.
Idaho medical leaders continue to share what they're seeing inside our hospitals. The medical system is under incredible pressure as hospital beds are filling up with very sick people fighting COVID. A major consequence, procedures and surgeries are being pushed back by days, weeks, and months to make sure there is room for the expected increase in COVID patients.
There are medically necessary time-sensitive procedures and care, and then there is care that can be delayed. So we're in the position right now of identifying care that can be delayed and pushing that off, hopefully through the peak of the surge, which still has yet to come.
Procedures or care that can be put off have been referred to by some as elective surgeries. Some have viewed that connotation, elective, as meaning procedures that are just very minor. Dr. Stephen Emerson, Chief Clinical Officer at Saint Als, says this is not the case and that the term elective surgery is not one they use. Here's why.
What in the mind is elective to somebody else may be very important to the patient. So we resist the use of the term elective.
Emerson says they examine situations to determine if they are emergent and urgent and make the best treatment decisions they can. Make no mistake, people in our community are suffering because they cannot get the care and relief they need. They may not be at risk of dying, but they will be in significant pain as things like orthopedic surgeries are pushed off.
These are procedures where people are actually debilitated and in pain. And so we're selecting which ones, if they are put off we're looking generally at a period of a month or more. So if they're put off for more than a month, do we think that the disability will be worsened by that? And if the answer is yes, we try and get them in. If the answer is no, then we regrettably put them to the side.
Medical workers are now in a position where they have to tell patients that their care needs to wait.
It's awful. You can imagine the emotional distress that we have looking at a patient in the face and saying, I'm sorry, we can't relieve your pain today. It's going to have to wait a week or two or a month or two. There's nothing much worse than having to do that.
The entire medical system in the state and region is under significant pressure, creating fewer and fewer treatment options. Medical leaders are calling on the community to do what they can to help the situation.
It did not have to be this way. If people would get vaccinated, stay away from each other in social events, and cover their faces, they wouldn't get infected with COVID. They wouldn't be coming into the hospital and taking up space for patients that also need us, that have been responsible, and all they want to do is get their care needs tended to and their pain relieved.
And to be crystal clear here, if you're having an emergency, you should still go to the emergency room. St. Alphonsus, St. Luke's, the medical system here, they're not asking people to stay away from the ER if they're having an emergency. But Brian, it is a situation where it is difficult, and as our ICUs and our hospitals do get busier, there will be a time where they're going to have to make some tough decisions. If 2 ER patients come in at the same time and there's only enough resources to treat one of them immediately, one will have to wait. They do have a system they go through to kind of score and decide who's going to get treatment first or when they're going to get treatment. It's a tough situation. Saying it's a tough situation is really an understatement.
Well, and it's all based on this fact that they can't do everything. They can't cover everyone. And we take this for granted. If I'm hurt or sick, I'll go to the hospital. But the staff is what is taking the brunt of this situation. We tried to talk about this to as many nurses and doctors about how overwhelmed and frustrated they are feeling right now, and you got a little bit of that today.
Yeah, and any frontline healthcare worker I've talked with in the recent months and really even the last year, they're completely honest when they say they are burnt out, this is extremely difficult, and they're wearing thin. And Dr. Nemerson, Brian, told me earlier that the medical workers, they need our support, something that we gave them early on in the pandemic. And I just want you to listen to what Dr. Nemerson has to say here about how valuable the support is and what type of support we could all be giving to our medical community.
I want to see those lawn signs going up saying thank you to those heroes. I want to see neighbors calling up, sending emails, text messages to the people that work with me saying thanks for what you're doing, because they're making more sacrifices right now than they ever have in the entire pandemic. They're working longer shifts, more days, more nights, answering phone calls. I can go on and on, at their own personal expense to keep you well. And it's time for those in the community who are responsible to recognize that and express that gratitude, because that's going to keep people going.
Okay, let me just recap something. At their own personal expense. Brian, you and I go home after our job is over, and we deal with what we deal with here. But imagine being a frontline medical worker for the last 18 months and having to deal with horrible situations, watching people die every day, watching people struggle to just breathe. You do this day in, day out, every day of the week for 18 months. It wears you out. You bring that home with you. They can only do so much.
And they're asked to stay extra longer for their shifts to cover for those people that are already burned out 15 months ago, because that first wave, when we all respected them, and we put those signs up in our yard and we sent them food and we did all these things that we are no longer doing. It is amazing. And as you also heard today, and here we are 18 months later, and they're still hearing patients who don't believe COVID is what put them in the hospital.
Yeah, just to wrap up quickly, Dr. Nemerson told me as recently as this afternoon, they are intubating people who are arguing with them as they're getting care, saying that they do not believe in COVID, and others have told me that they've argued with patients who say, you've poisoned me, this is a hoax, I don't know what you've done to me.
It's amazing that they deal with that. But again, all it takes, according to Dr. Nemerson, a little gratitude and expressing that gratitude for our healthcare workers. Thanks, Joe.